Hello everyone, this lesson is on Restless Legs Syndrome, or RLS. RLS is a neurological disorder that causes an unpleasant sensation in the legs, so we'll speak about the causes and conditions that are associated with it. In addition to talking about some of the pathophysiology behind why this occurs, we're also going to talk about some of the anatomy behind this. We'll also go through the indicators and symptoms, as well as how it's diagnosed and treated. Before continue, I ask you for subscribe the channel for help this new channel. If you need additional assistance, I found a program called RLS. It is specifically designed for the restless legs niche and is meant for women or ma'am who suffer from this syndrome for years. I'll put below this video the official website for you to have additional information. So please visit because this program can help you. So let's continue. Restless Legs Syndrome, also known as Willis disease, is a chronic ailment characterized by recurrent episodes of an uncontrollable impulse to move legs. So, according to the epidemiology, this is a common condition that affects 5–15% of the general population. There are certain patient populations that are at risk for this condition, and one thing to keep in mind is that pregnant women up to the age of 29 will be diagnosed with restless legs or restless legs syndrome. Patients with end-stage kidney illness, about half of whom will develop legs syndrome, will also have this ailment, and there may be a genetic syndrome risk. Patients with end-stage kidney disease, around half of whom will develop legs syndrome, will also have this ailment, and a hereditary syndrome risk exists. As a result, having asthmatic family members raises your risk of developing asthma, and beginning of asthma early in childhood makes it more likely. Let's speak about the associated risk factors and conditions given that the child has a family history of restless leg syndrome. The following are some of the risk factors and conditions linked to restless leg syndrome. A lack of iron. The associations between iron deficiency and efficiency and iron deficiency anemia are all associated with restless leg syndrome. Another risk factor for restless legs and restless leg syndrome is a vitamin B12 deficiency. Another risk factor is alcohol consumption. We can also see that coffee consumption is a risk factor. We've already mentioned that people with kidney disease, particularly those with end-stage renal disease, are more likely to have restless legs or restless limb syndrome. Patients with diabetes are more likely to develop certain illnesses, such as peripheral nerve disorders, which can lead to restless leg syndrome and venous insufficiency. Thus, if there is venous drainage issues in the legs, this will increase the risk of restless leg syndrome. A diagnosis of celiac disease is also another associated condition, as well as a history of fibromyalgia is also another associated condition as well. We also mentioned family history is also a risk factor before, and then there are medications that can cause RLS, including diphenhydramine, which is Benadryl, the selective serotonin reuptake inhibitors or antidepressants that can also increase the risk of restless legs and restless leg syndrome, and then also TCA antidepressants can also cause this condition as well. Now let's discuss the pathophysiology behind this condition. The pathophysiology of restless leg syndrome is related to changes in iron and dopamine function in the brain. Therefore, if we were to look at this image here of the brain's very complicated image, we do not really need to know all of these different parts of the brain and these pathways. However, I want to focus on two areas here: the thalamus and the substantia nigra. These two areas are involved in muscle movement, so dopamine excess within these areas within the substantia and the thalamic areas of the brain appears to be related to restless leg syndrome. And then in the same areas there has also been a decrease in iron. If cells in those areas have decreased iron, this seems to also be related to the onset of symptoms of restless leg syndrome. In regards to patients who have end-stage renal disease, this has also been related to the onset of symptoms of restless leg syndrome. It is uremia or a rise in blood urea that appears to be the cause of restless leg syndrome in those patients. Let's talk about the signs and symptoms. So by far, the most important symptom of this condition is a strong sensation. So there is an unpleasant, uncomfortable sensation in the limbs. In some cases, the arms may be affected. It is described as a restlessness in the legs. This feeling improves with movement. Therefore, There is a feeling or an urge to move the legs. It is unpleasant, but when that patient actually moves their legs, there is a temporary relief of that discomforting feeling. And then what happens is there is a worsening of this feeling when the patient begins to rest their legs or during rest. It is the sensation of movement which is improved by rubbing the body. Moreover, it may also be relieved by rubbing the limbs or rubbing the legs. The symptoms of Restless syndrome are more likely to occur in the evening and at night, as they often occur within the specified time frame. There are some cases in which they can occur throughout the day again. Most of them occur in the evening and at night. As a result, you're more likely to experience symptoms of sleep disturbances. Indeed, you can imagine that if you're trying to sleep with legs feeling like you need to move, you can't. And this condition causes insomnia, and fatigue is common with these patients. And this is associated with another condition called periodic limb movement during sleep. And 80% of restless leg syndrome sufferers have involuntary jerking movements of their limbs. So it is a highly associated condition with restless leg syndrome. Treatment is based on DSM-5 criteria. DSM-5 criteria: the urge to move legs occurs with rest, is improved with movement, and is worsened in the evening or at night. So those are the symptoms we just discussed. Now the DSM-5 criteria has a specific time frame that needs to be met for these symptoms. So these symptoms must occur 3 or more times per week for at least 3 months. This is the required time frame according to the DSM-5 criteria. Now, there are other diagnostic criteria that do not have time requirements. We will talk about that as well here in a moment. And another important aspect of the DSM-5 criteria is that the symptoms cause significant distress and impairment. And then a criteria in DSM-5 is that the symptoms are not caused by another condition or medication. We talked about certain medications that can cause restless leg syndrome. But if it is deemed that one of those medications is causing the symptoms, then it would not be considered restless leg syndrome. But there is another criteria which I note here: the International RLS or Russell Psych Syndrome Study Group. And they have another type of criteria that does not have the time requirement and does not have this exclusionary criteria. Therefore, even if it is deemed to be caused by a medication that doesn't matter, it is still considered restless leg syndrome, and then accordingly, the restless requirement is not required, so you might have less frequent episodes for a shorter period of time. These are 2 criteria that can be used in order to diagnose restless leg syndrome. So this is the DSM-5 criteria, but if you want to use the International RLS Study Group criteria, then this time requirement and this exclusionary criteria are removed. So that's basically the difference between those 2 criteria. Now let's talk about the treatment of this condition. It depends on the underlying cause. We talked about many causes before, including iron deficiency, vitamin B12 deficiency, and some other causes as well. So, if the underlying cause is identified, treatment is important to prevent it. Vitamin B12 and iron supplementation may be helpful. We talked before that deficiencies in iron and vitamin B12 can cause restless leg syndrome. Now, the other treatments include dopamine agonists. Hence, dopamine agonists are a first-line therapy. One such example is clonazepam, which is a benzodiazepine. Although tachyphylaxis can occur with prolonged use, this causes gabapentin to wear off over time. Gabapentin is used for moderate to severe cases, so much of the time going to be important to identify and treat the fundamental cause. And then some of these other treatments can be used as well. So, if you're interested in learning more about restless leg syndrome neurological problems, the website listed below can assist you. In the description of this video, I fixed the link that goes to the homepage. Thank you very much for watching, and I hope to see you next time. Please like and subscribe for more lessons like this one.